Welcome to this in-depth review of the University of Iowa hospitals, based on my personal experience using their services and navigating their website. As one of the top academic medical centers in the country, University of Iowa Hospitals claims to offer world-class care with a strong focus on education, research, and specialized treatment. But does it live up to the reputation? Let's find out. Upon visiting their official website, the layout is fairly intuitive and professional. The homepage prominently features search tools to help users find doctors, make appointments, and access medical records. I appreciated how the menu structure is organized by care areas, patient services, and health topics. However, it's worth noting that the load times were slightly sluggish during peak hours, which can be frustrating if you're in a hurry. The Find a Provider tool is well built, with robust filters that allow you to search by specialty, location, and even gender preference of the doctor. What stood out to me is the level of detail in each provider's profile, including education, clinical interests, and language spoken. However, some listings were missing recent reviews or patient ratings, which makes it harder to evaluate doctors you're not familiar with. Making an appointment through the MyChart system is mostly seamless, provided you already have an account. If you're new, registration can be a bit of a hassle, requiring multiple verification steps and document uploads. Still, once logged in, managing appointments, viewing test results, and messaging providers is relatively straightforward. When it comes to their facility information, the site provides virtual tours, directions, parking info, and even nearby lodging options. This is especially helpful for patients traveling from out of town. I also explored their telehealth offerings, which are becoming more important these days. Their system supports video visits through the MyChart app, but you'll need to ensure a proper setup beforehand, and tech issues are not uncommon. One issue I encountered was a lack of transparency in billing information. While there is a billing portal and some explanation of insurance coverage, the price estimator tool lacks clarity and doesn't give real-time quotes for many services. This makes it harder for patients to make informed decisions based on costs. The research and education sections are extensive, showcasing their partnerships, clinical trials, and training programs for medical professionals. It's clear that University of Iowa Hospitals is deeply committed to academic excellence, and they promote this heavily across their site. Accessibility-wise, the site performs decently, offering tools for screen readers and text resizing, though some users may find the color contrast on a few pages lacking, especially in mobile view. In conclusion, the University of Iowa Hospitals offers many strong features like comprehensive provider profiles, integrated MyChart access, and solid patient resources. But there's room for improvement in billing clarity, page performance, and support responsiveness. If you found this review helpful, please give it a thumbs up and consider subscribing to the channel for more honest reviews like this.